This lecture is on blood vessel. When we talk about blood vessels, I believe we should also know about this person. He is Galen. At that time, it was in 129 AD, Roman Emperor. He was a well-renowned physician, and he has a significant influence on these vessels. And this Galenic teaching at the time was there are two types of blood in our body. And the venous blood, which is formed in the liver, and it is filled with nutrients. And the arterial blood was infused with vital spirits, and it originates from the heart. And at that time, they understood that, the blood comes to the cell and the body consumes the blood, or the blood evaporates. So modern way of understanding about our cardio, pulmonary, and circulatory system was described by William Harvey, who was an English physician. So from that time, we know that the blood came from the heart, and from the heart, the blood is pumped into the artery, and finally, vessel becomes small and get into the capillary circulation. And from the capillary circulation, it continues as small. All these small capillaries, they unite to form small little veins, which are called venules. And finally, these venules merge together to form a bigger vein, and finally large vein, and enters into the heart. And from our previous lecture, we know that an artery is any vessel taking the blood from the heart. And a vein is a vessel taking the blood back to the heart. And this does not concern with the quantity of blood, quality of blood. It doesn't matter whether it is oxygenated or deoxygenated blood. And let's say this is our heart. From the heart, a large blood vessel came out, that is aorta. So aorta, initially it goes up towards the head and neck, and it's gradually come into an arch and finally come down. So this is the arch of the aorta, ascending aorta, arch of the aorta, and going down, descending aorta. And from the aorta, we have three main vessels arise. They are brachiocephalic, which we later divide into right subclavian and right common carotid artery. For the left side, the left common carotid artery and left subclavian artery, they originated from the arch of aorta independently. And of course, common carotid artery will go to the head and neck to give blood supply, and subclavian arteries will go to the arm, and that is the main blood supply for the upper limb. And now this descending aorta continue downwards. It will go through the diaphragm. In the thoracic cavity, the descending aorta will be called thoracic aorta. And once it perforates through the diaphragm and it gets into the abdominal cavity, the name changed to abdominal aorta. And finally, abdominal aorta will bifurcate into right and left common iliac arteries. And now in the abdominal aorta, we have two paired arteries. paired arteries mean the artery is present for the right side as well as the left side. The first pair artery is renal artery. Renal arteries, these are the arteries which are going to the kidneys. And second pair artery is gonadal artery. That means in male, it is testicular artery, and in female, it is ovarian artery. So these are the two pair arteries of the abdominal aorta, renal artery and gonadal artery. Now I'm going to add a few more arteries arising from the abdominal aorta. So we remember these are the right and left renal arteries, and these are right and left gonadal artery. And now we have three unpaired arteries which are directly originating from the abdominal aorta. The first one is celiac artery, second one is superior mesenteric artery, and number three is inferior mesenteric artery. So inferior mesenteric artery is between the gonadal artery and the bifurcation of aorta. Celiac artery arises from the abdominal aorta immediately after perforating through the diaphragm, and superior mesenteric artery is above the renal arteries. So now let's look at the cross-section of the arteries or any blood vessel. Blood vessels, they have three layers in their wall. So this is the lumen of the artery or a vein, artery, lumen of a vessel. And here we will have blood flowing. And the three layers are innermost, which is tunica intima, middle layer, tunica media, and outermost, we have tunica adventitia. So it could be in the artery or it could be in the vein. We have three layers, tunica intima, media, and adventitia. So tunica intima is the innermost. Its tunica media cell are just simple squamous epithelium, one layer cell, flat cells. But of course, in the blood vessel, we have to call endothelium. They are smooth and they reduce the friction of the blood flow. And in large blood vessels, like when we say large blood vessel, I mean diameter more than 1 millimeter, they may have a layer underneath the endothelium, which is called subendothelial layer. Now we will talk about tunica media, which is the middle layer, which is mainly filled with the smooth muscles. Of course, it will also contain some amount of elastin and some amount of collagen fibers. So if you look at this diagram, these smooth muscles are arranged in a circular fashion. So these smooth muscles are encircling the lumen of the artery. And therefore, contraction or relaxation of these smooth muscles in the tunica media will determine the diameter of the blood vessel. And these smooth muscles are controlled by sympathetic vasomotor nerve. The outermost layer is tunica adventitia. Tunica adventitia, it is made of collagen fibers and elastic fibers. And now, if you look at the diagram here, drawing, the tunica adventitia collagen fibers are running longitudinally along the blood vessel. Their job is to strengthen the vessel and to anchor the vessel to the surrounding structure so that the vessel wall doesn't move. And now let's look at the histology slide. under the microscope. And this is a histology specimen from the large vessel. For example, it is elastic artery. So aorta, the largest artery in the body is aorta, and aorta is the elastic artery. If you look at here, we can see the endothelial layer, which is called tunica intima, middle layer, tunica media, and the outermost layer, tunica externa. This is the inside the lumen. So now in the tunica media, we have some elastic fibers, elastin are present. And of course, if we look at that, this muscle layer is very thick, and therefore the smooth muscle for this tunica media layer needs blood supply. And the blood supply comes from the lumen via the diffusion, especially for the inner half of the tunica media wall. But the outer half of the tunica media wall needs special blood supply. And those vessels, which takes oxygen to the wall of the blood vessel, they are called vasa vasorum. And now if you look at this histology slide, it is taken from the muscular artery, which is the medium-sized artery. And you can start see the thick tunica media. And tunica media is more made of the smooth muscles. And now the vessels become smaller from the large elastic artery to medium-sized muscular artery. And now we go to the smallest artery, which are called arterioles. And in arterioles, most of the arterioles, we still have three layers, like innermost endothelium, middle tunica media, and they might have some tunica adventitia. So even the blood vessel walls need blood supply, and that blood supply is carried via the vasa vasorum. So now we know that there are three types of artery: elastic artery, muscular artery, and arteriole. We got small little veins, which are called venules, and finally become veins. And of course, just before the vein enters into the right atrium of the heart, the veins are really large, and they are called vena cava. So now let's talk about elastic artery. When we talk about elastic artery, they are situated closest to the heart. These are the large artery near to the heart. The best example for the elastic artery is aorta. So aorta diameter is very large, and it has a lot of elastin in its tunica media layer. And if we think about this law, Poiseuille's law, the resistance of the blood flow is conversely related to the power of foot radius. And therefore, the aorta, because the diameter is very big, and the resistance of the aorta to the ejection or pumping pressure of the left ventricle is reduced. So Poiseuille, these are the German and French scientists who start talking about this law. So elastic artery, the best example is aorta. Their diameter will be 10 to 25 millimeter in diameter. They have high elastin content in their tunica media, and it helps with the pressure surge because they are elastic and expansile, and their diameter is large, and therefore they will absorb the impact, and they do not put too much pressure on the left ventricle. And also they are elastic required property, we propel the blood forward further. And muscular arteries their size are less than 10 millimeter down to 0.3 millimeter in diameter. These are the arteries of the individual organ, for example, like renal artery, radial artery, or ulnar artery. So these are the medium-sized arteries. Their tunica media is thick and made of smooth muscles. And they have internal and external elastic membranes. Of course, once the blood vessel, medium-sized vessel, traverse further, their diameter becomes smaller and smaller to maintain the flow of the blood in the lumen. Arterioles, which are the smallest arteries, they are 0.3 millimeter to 10 micrometer. The larger arterioles, we have 3 layers, tunica intima, media, adventitia, but smaller arterioles will not have 3 distinct layers. An internal elastic membrane might present, and their diameter will be controlled by sympathetic, as well as the local hormone and local factors. And now, after the arterioles, we get to the capillaries. So capillaries are not from the arterial system. They are not from the venous system. They are something in between, which capillaries are connecting arterial system to venous system. And their structure is very different. Their diameter is 5 to 10 micrometer in diameter. So they are very small now. They do not have 3 layers anymore. They do not have tunica intima, media, adventitia. They only have the innermost tunica intima, which is made of endothelium. And of course, these endothelial cells need to lie on the fibrous tissue, which is called basement membrane. And because of the thin walled layer of capillary, there will be exchange from intraluminal with the extraluminal part of the capillaries. So now let's go back here. So we know that any blood vessel, either artery or a vein, we have tunica intima, media, adventitia, or externa. In a large vessel, underneath the endothelial layer, we will have subendothelial layer. And after that, we have the muscle layer, tunica media, which is made of muscle with or without elastin or collagen. And on either side of the muscular layer, we will have internal elastic membrane and external elastic membrane. And in large vessels, we will have vasa vasorum. And if you look on the veins, they are pretty similar to arteries. But in veins, we do not have internal elastic membrane or external elastic membrane. That is one difference. And the other difference is inside the venous lumen, there are valves. These valves are one-way valve, which we take the blood from distal to central. And once the blood flows through the valve, in normal circumstance, the blood cannot go backward. And now arterial system and venous system, they are connected by the capillary vessels. These capillaries only have one endothelial layer, and this endothelium will sit on the basement membrane. So let's go and talk about capillaries. So there are three types of capillaries we know: continuous capillaries, fenestrated capillaries, and sinusoidal capillaries. So what is continuous capillaries? If you look at the endothelium, these endothelium, they are attached to each other, and there is no significant gap in between one endothelium and the other endothelium. The space in between the endothelium is called intercellular cleft, and there is no significant space in this intercellular cleft. And therefore, the exchange between the intracapillary and extracapillary is highly restricted. So this is the least permeable and most common type of capillaries. They are seen in skin, muscle, or even in the brain. So second type of capillary is fenestrated type of capillaries. And now here we can look that in the endothelial cells, there are small perforations which are called fenestrations. The intercellular cleft between the endothelial cell, they are stay tight. And because of these little fenestration, there is more exchange between intracapillary and extracapillary. And therefore, we will use this type of capillaries in organs where we do need absorption or filtration. And the best example for this is kidney and the small intestine. And number three type of capillary is sinusoidal capillaries. Now here you can see there are large pores in the endothelial cells, as we can see here. The space intercellular cleft between one endothelial cell and another endothelial cell has become very large. That means there is most significant exchange from the intracapillary to extracapillary. This is the capillary which permits more exchange between the intra and extracapillary. And therefore, they are present in special location where we need significant exchange between the capillary and its environment. Therefore, we will use it in liver, spleen, and bone marrow. So, as we have seen, capillary permeability depends on the intercellular cleft, whether fenestration is present or not, if they are present, how big they are, and direct diffusion through the endothelial membrane. Of course, there will be some pinocytic vesicles which is carrying the molecules from intracapillary to extracapillaries. So now if we look at the blood-brain barrier, BBB, the brain capillaries are continuous capillaries. And therefore, we can tightly control the transmission or exchange from intracapillary to extracapillary very carefully. And only the vital molecules can leave the capillaries. Vital molecules such as glucose, oxygen, carbon dioxide, and some anesthetic gases can cross the blood-brain barrier because the capillaries for the brain, they are continuous capillaries. We know that the capillary beds connect arterial system and venous system. And arterial system ends as arterioles. And in between the arterioles and before it became capillary, there is one more step, and that vessel is called metarterioles. So metarteriole sits in between the after the arteriole and before we start capillaries. And after the metarteriole, there are sphincters, which are called precapillary sphincters, before they enter into the capillaries. So now I'm going to show you this slide. This is a very useful slide. I want you to have a look And think about that. So we have talked about elastic artery, muscular artery, and arterioles, and capillaries. So these are the contents here. We said endothelia, tunica intima, tunica media, which has got smooth muscle and elastic tissue, and tunica adventitia or tunica externa, which is collagen tissue. So if you look at that, in muscular artery, the muscular content is far more than the elastic artery. Of course, in the elastic artery, the elastic content is highest, and muscular artery elastic content is low. Once we got to the capillary level, we do not have elastic tissue, we do not have smooth muscle, we do not have any tunica externa. We only have one layer, that is the endothelial layer. And the veins, as we can see, continue, and the veins, we have all endothelium, muscle, and elastic fibers, and connective tissue surrounding. Of course, there will be different proportion. So now if we take a histology specimen for an artery and a vein, because of the high muscular content, the artery remains in a circular shape in cross-section. In veins, because there is very small amount of muscle layer, and therefore the veins can easily get flat. Once we finish with the capillaries, all the capillaries merge together to form small little veins, which are called venules. Venules are very small, just about the size of the capillary or might be slightly bigger. And therefore, the smallest venule might be the size of capillary, about 8 micrometer. Of course, they gradually get bigger and bigger, and some will be about 100 micrometer. In the postcapillary venules, we have endothelium and pericytes only. But once the venules become larger, let's say once they get to the size of 100 micrometer, we will have tunica media. So in the small venules, we only have endothelium and pericytes. So the veins, once the venules merge together to form bigger veins, and the veins lumens in general are larger than arteries. They have thicker tunica externa, which is the outermost layer, comparing to tunica media. As if we remember the histology slide of the artery, tunica media is large and tunica externa is small, and that's reverse in the vein. They have less elastic fibers, they are low pressure system, and inside the veins, we do have valves. So now if we look at the valve, and if we think how our venous blood from our foot and toes can return towards the heart against the gravity. Of course, these veins, they do have valves inside the lumen, which act as a one-way valve. And once the blood go through the valve, there is no return, no backward return. On top of that, our muscles, which surround the veins, with the muscle activity, the venous blood will be pumped towards the heart. Vascular anastomosis means from one blood vessels, which could be either artery or a vein, and going to join another artery or a vein. That is called vascular anastomosis. Just because of this anastomosis, if one blood vessel is blocked, its collateral vessels will continue and distribute to the area it initially supplied. And now let's talk about the heart. And I want you to remember the aorta, brachiocephalic, common carotid, and subclavian. On the left side, there is no brachiocephalic. The common carotid and subclavian originate from the heart in a separate way. And the internal jugular vein, which is following the subclavian vein, which is following the subclavian artery, and subclavian vein on the left, which is following the left subclavian artery. And the subclavian vein and the internal jugular vein join together to form the superior vena cava. So this is the left brachiocephalic vein. This is the right brachiocephalic vein, which is formed by the internal jugular vein and subclavian vein. The right and left brachiocephalic vein will join together to form superior vena cava. So I want you to look at these diagrams and follow the arteries from the heart, brachiocephalic, right subclavian and right common carotid. Right subclavian will continue as axillary artery. Axillary artery will continue as brachial artery, and just distal to the elbow, the brachial artery will divide into radial artery and ulnar artery. So I want you to follow these blood vessels, and as we can see here, and I want you to remember, because these are the major blood vessels of the body. And I said our descending aorta from the thoracic cavity perforate through the diaphragm to come into the abdominal cavity. So there are three main structures which are going through the diaphragm. They are inferior vena cava, esophagus, and aorta. So it is worth remembering the vertebral body level where these organs go through the diaphragm. So at the level of vertebra 8, the inferior vena cava pass through the diaphragm. At the level of vertebra level 10, esophagus will go through the diaphragm. And at the level of thoracic vertebra 12, aorta will go through the diaphragm. The way we try to remember is VOA, Voice of America, 8, 10, 12. So now, like this is the inferior vena cava, which is going through the diaphragm to get into the thoracic cavity, and this must be at the level of spine vertebra, thoracic vertebra 8. And now we can see aorta coming into the abdomen from the thoracic cavity, and this level must be vertebral body, thoracic 12. And I want you to follow these arteries. So the very first artery arising from the aorta, once it enters into the abdominal cavity, is celiac artery, celiac trunk. And celiac trunk give three branches. Number one, common hepatic artery, which is the artery to the liver, as we can see here. Splenic artery, which is going to give blood supply to the spleen, and left gastric artery. So these are the three branches from the celiac artery. And now we can see the superior mesenteric artery. We can see the gonadal arteries. We can see the renal arteries. They are the pair branches. And these are the levels. They are arising from the aorta. And I want you to keep follow these vessels like superior mesenteric artery will give blood supply to the small intestine and quite a good significant part of the large intestine, which is from the cecum, ascending colon, transverse colon towards the right 2/3 of the transverse colon. From the left 2/3 of the transverse colon down the left 1/3 of the transverse colon down the descending colon and sigmoid colon, they are supplied by the inferior mesenteric artery. And now we know that our abdominal aorta ends by bifurcating into right and left common iliac artery. Common iliac artery will give a big branch into the pelvis that is called internal iliac artery. After giving them that branch, the common iliac artery continue as external iliac artery. And this external iliac artery, after passing underneath the inguinal ligament, its name changed to femoral artery. So now this is the common iliac artery, which will give a branch internal iliac artery to the pelvis organ, and common iliac artery will continue as external iliac arteries. And now I want you to follow this. And femoral artery is called popliteal artery behind the knee. And that popliteal artery will divide into anterior tibia and posterior tibia artery. And that posterior tibia artery will also give another branch, which is called peroneal or fibular artery. So these are the main artery branches which we need to know. And usually the veins follow the arteries, but there are two types of veins in our body. They are superficial veins and deep veins. So usually deep veins, they will follow the artery and they will flow in opposite direction. But superficial veins, they are close to the skin and they do not follow the artery. So now if you think about again, like femoral veins, we continue as external iliac. The internal iliac vein will enter into the external iliac, and now after the combination that is called common iliac vein, right common iliac and left common iliac vein will join to form the inferior vena cava. So I want you to go through this, the names and the flow of the arteries and veins in the body. And now the common iliac join to form the superior vena cava. The renal vein enters into the inferior vena cava, and adrenal veins, the vein from the adrenal gland, enter into the inferior vena cava on the right. But there is a difference. The left adrenal vein or suprarenal vein drains into the left renal vein. It doesn't go into the inferior vena cava straight away. So this is the cadaveric specimen. And I want you to follow these veins and check how do they march and what veins do they become in our body. And now if you look at the venous blood from the stomach, small intestine, and large intestine, they will form like superior mesenteric vein, inferior mesenteric vein, inferior mesenteric, and the splenic vein join together, and they will combine with the superior mesenteric to become hepatic portal vein, and this portal vein will drain into the liver. So now, as we know from the arterial system, from elastic artery, medium-sized artery to small arteries, which are called arterioles, and they will have to join the venous system via the capillary bed. But I hope you remember a venous system which we call portal venous system. So in portal venous system, capillaries from the intestine, which absorb all the nutrition from the intestine, they are taken to the liver via the hepatic portal vein, as we saw from the previous slide. And now once they go into the liver again, they split into capillaries. So now if we look at carefully, here we start with the capillaries, which will become vein, and again it will split again into capillaries. So this is what we call portal system. So we saw one portal system in hypothalamo-hypophyseal in pituitary gland portal system, and here we see another portal system, which is called hepatic portal system. And venous flow from the brain has very different arrangement. All the small little veins will drain into the large venous pool. They are called venous sinuses. So there are multiple venous sinuses in the brain, in the cranium. Some of them are superior sagittal sinus because it's at the top, inferior sagittal sinus because it is lower, and they all merge, and cavernous sinuses, sigmoid sinuses, they all merge together and finally come out of the cranium via the jugular foramen. Once they go through the jugular foramen, the venous structure is called jugular vein. So now we have right internal jugular vein. And that, of course, that internal jugular vein, we combine with the subclavian vein to become brachiocephalic vein. Right brachiocephalic vein and left brachiocephalic vein join together to form superior vena cava. And there is one clinical condition we call varicose vein. So the veins, this is normal vein, then there is a one-way flow of blood from down to the top. And once the blood has gone through the valves are competent and they close, and therefore there is no backward flow. So if you look at this diagram, when the valves become incompetent, there is backward flow, retrograde flow of the blood, and there will be peripheral pooling, and the veins become gradually filled with more and more blood, and the veins become dilated and finally become tortuous. So this is an example of the varicose vein, which are abnormally dilated, abnormally tortuous veins in the superficial venous system because of the, let's say, the valve incompetency in the veins. So I'm going to stop here soon. And this is the varicose vein. And the last diagram is abnormal dilatation of the arteries. So as we know, this is our abdominal aorta. The size of the aorta, which is elastic artery, the largest could be like 25 millimeter. And now they become abnormally large. That is what we call aneurysm. Aneurysm is the abnormal dilatation of the blood vessel. And look at this aneurysm, which is quite distended here. And therefore, if you have a chance to put your hands on somebody's abdomen, and usually we won't be able to feel the pulsation of the aorta easily in a normal person. But once we can feel that, then that means the aorta might be dilated and we need to think carefully. So I'm going to stop here. And we will see you in the lab so that we can discuss more all about the arteries which we saw in the diagram, and we go and identify those on the cadaver. All right, thank you.